Hello. Good afternoon, good evening, good morning, depending on where you are. This is Dr. Tolulope Alugo from St. John Cap. So today we're going to be discussing about autism spectrum disorders. If you've been following us, you know that the theme for this month is autism. Last month it was depression, and the month before that ADHD. And we've also been talking about how parents with kids who have a diagnosis of mental health disorders can empower their mental health. And we did say an important part of doing that is educating ourselves. So as part of that bid to educate ourselves, today I have a very special guest with us. I'm going to get her to introduce herself. We'll be taking questions towards the end, so please type your questions as we go along, and we'll address them towards the end of our session today. So my guest is Dr. Nike Aladetoyinbo. Dr. Nike, thank you very much for joining us today. I'll get you to introduce yourself in further detail, and then we'll kick off our discussion.
Pleasure to be here. Good evening, everyone. Thank you for making our time for this session. And it's so relevant because this month happens to be the World Autism Day. So I'm a general pediatrician, and I have a background of, starting off in Nigeria. And I kind of cut across cultures. I've been privileged to work in the Republic of Ireland, and now in Canada for the last 13 years as a general pediatrician. And I do see a whole lot of patients with autism spectrum disorder. And like it says, it is a spectrum. So I'm hoping that I'm able to enlighten us on this category of unique people. Thank you, Dr. Alugo.
Thank you so much, Dr. Nike. So you mentioned that you're a general pediatrician. I'm wondering what age group you typically see in your practice.
So as a general pediatrician, I do see right from newborn, from the first hour of life of a baby till 18 years of age. So it's a good chunk of time to be with the kids.
Wow, that is so awesome. Just to say to our viewers, sorry we don't have our videos on today. Just bear with us, and hopefully you can get the information from the audio, and we're happy to just take any questions and hope that you'll find this of benefit. So you mentioned that you see kids from the age of 0 to the age of 18. Wow, that's a long time to be involved in a child's life. I'm wondering, the children you see with autism, how early are you seeing them?
Yes, so it varies, but generally speaking, being a neurodevelopmental disorder, it's meant to be, at least observed by age 2. Just allowing for development, you need a child to at least grow up until age 2. Having said that, there are some other categories of autism spectrum disorder that will actually happen beyond age 2. Between age 2 and 10, there is a special category, and that is a very severe autism. And it used to have the name childhood disintegrative disorder. And in that case, there is regression of the kid's milestones between the age of 2 and 10. But having said that, it would not just be the typical broad areas where the autism spectrum will be affected, but it will also involve their motor milestones. So that's why I call them a special category.
Okay. So, before you go into further detail about, the different categories and the symptoms, I'm just wondering, what is autism? What is autism? What are autism spectrum disorders? Can you differentiate between them, and what are they, in general?
Yes, thank you for that question. So autism spectrum disorder is the new term that the Diagnostic Statistical Manual 5, is encouraging, just because of the amount of studying that's been gone through over the years. In the past, it used to just be called autism, but as research unfolded, it was observed that a better terminology would be autism spectrum disorder. Like I was trying to say, it is a neurodevelopmental disorder. Neuro in the sense that it involves the brain and how it develops. But the major issues of impairment in autism spectrum disorder are categorized into three. So you've got the issue with social interaction, and you've got the issue with um, communication and behaviors. So that's all those three categories has to be fulfilled, and it has to be occurring in some degree of persistence across different situations. So someone can't just come and say that, oh, I only notice it by myself. We would love to see the child in another environment to see if it's a persistent issue. And it would be nice to see that kind of issue go through those three broad categories. Yeah.
So you mentioned that these children will have difficulties with communication, with behavior, and with social interaction. And
Mhm.
these difficulties, we will see them in more than just one place, not just home, but maybe daycare, visiting family members, or and so on and so forth.
Correct.
So who does autism affect?
Oh, so autism is no respecter of anyone. It's no respecter of class. It's no respecter of race or ethnicity, and you know, it's such a it's such a big disorder that um, unfortunately at this point there is nobody can pinpoint a genetic panel or chromosome that's the main issue that cuts across most autistic kids. So there is an interplay between the genes and the environment. And even speaking to the environmental associations, there are still no clear research to define what particular issues in the environment uh, could be associated with it, but there are some that have more evidence outside of the genetic issues. So things like being born in an extremely uh, low gestational age, like 24 weeks and up to like 28 weeks, poses a big risk. You know, being a low birth weight baby poses a big risk as an environmental kind of factor. Also, if the mom, while pregnant, had a niggling infection, even if it's as mild as a cold, but if it was more prolonged than normal, it could have a way of impacting the genes. And of course, we know that, having spoken that there is some genetic component to it, even though we don't have a particular gene to nail down yet, we know that it's more common when there are siblings or when there's a family history of autism. And of course, um, like we were talking about, the parents' age will be a big issue in predisposing to autism. So, and I'm talking about advanced parental age, not just the mom's age, but mom or dad, or mom and dad, as the case may be. Yeah, so those are contributory factors to this autism, and that will be why it cuts across classes, social classes, races, and yeah.
Do you find that it's commoner in male than female, or is it kind of equally distributed?
It is commoner in the males. It is in a ratio of one for the female, four to the male. So the
Okay.
females are more advantaged because of the extra X chromosome, which is protective. Again, why it is protective is not fully known, but at least something in the plus. for the females. And that also speaks to several other diseases. Males seem to get the brunt
Mhm.
because they lack an extra X. So, yeah.
Wow. So having that extra X is an advantage. So women, yay to the women.
Mhm.
How you mentioned so many different risk factors. You mentioned, age of the parents, pregnancy issues like low birth weight or having infection in pregnancy. So with all of this, I'm wondering how common is autism?
Oh, autism is commoner than we think or imagine. It is one in every 60 children. It is
Wow.
that common. It is very common. So we're saying that, to put it in perspective, it's like 62 million people across the world are on the spectrum in one way or the other.
Wow. Okay. Um, what are the usual symptoms of autism that or before I come to that, who normally picks this up first? Is it the parents? Is it school? Is it just routine pediatrician checks that uncover these symptoms? Typically, in your
So,
experience.
yes. So, speaking to the pediatrician's visits, first of all, yes, every parent that brings their child for follow ups would expect the developmental milestones to be looked at, both by examination and by history from the parent. So I would say that parents that are astute can actually pick up the signs, and of course, to corroborate what the parents have noticed, it could be confirmed during pediatrician visits or doctor visits. So those will be like the routine checks for milestones, which happens at 2 weeks of life, 2 months of age, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2 years. Not to say that nothing else happens beyond 2 years, but having spoken to the fact that it's a neurodevelopmental disorder and it should ideally be picked up around that time. And to corroborate the developmental milestone checks, there are some screening uh, questionnaires out there that the parents could even have stumbled on. One of them is called the M chart,
Mhm.
whereby yeah, the full name for that is the modified checklist for autism um, in toddlers. And it's supposed to capture autistic traits or symptoms between age 16 months and 30 months. So, assuming that the child, it wasn't too obvious to the eye by age 2 years, that particular questionnaire is still applicable beyond age 2 years. So you can use it even as, and it's free. It's available to the parent. It's available to the daycare staff as well. And I'm
Okay.
aware that some daycare staff would actually screen periodically as well.
So it's called the M chat. I've just put that on the screen, just so if people wanted to take a note of that, just for themselves.
Yes, so that is MChat. And of course, there is another tool, called the ASQ questionnaire. And
Mm-hmm.
that's equally easily available. And there is the ASQ from about the 15 month, even up to age 5. It runs to age 60 months. Because, like I had mentioned in my preface, that there is a special category of autism that may not really be obvious until after age 2.
Right.
So, yeah. So, we really must capture all of that.
So, what are the typical symptoms that these children will present with? I know you mentioned those three broad categories, but I'm wondering if you could give examples of
Mhm.
what symptoms the parents may notice or daycare staff may notice.
Yes. So, being a neurodevelopmental issue, parents could begin to notice that by age 6 weeks that the kid is not smiling.
Hmm.
That's a critical stage for a social smile. Social in the sense that the baby is responsive with a smile when you smile at the baby.
Yeah.
So it's not just the one of those fake smiles, it's a real smile. Having said that, if the baby was born premature, you have to correct for that. Otherwise, you'll be panicking for no reason because
Hmm.
their real true age has to be corrected for if they were premature. But they could begin to notice something as as mild as, oh, why is this baby not smiling? And then by age 6 months, they might wonder, maybe I'll say between age 6 and 9 months, why the baby is not babbling. So again, the good thing is that all of this could be captured as long as the parents come to their routine appointments. That was why I threw out those cutoff points for routine baby and infant check. So again, beyond the 6 months, uh, you're supposed to begin to really notice some words and a little more social interaction, and you might begin to find that there is just that deficit in the number of words, or in the use of words, or in the way of interaction. Maybe they're just not making eye contact when you're talking to them. It would seem as if they're not listening when they're being talked to. It would seem as if they're just ignoring, whoever is talking to them. The interest is just different. So there is something we call joint interaction, and that generally is not qualitative in this category of patients, and they don't understand nonverbal communication. Their body language might not be the typical norm. They might have some stereo mannerisms that are kind of different for you, for this, for social acceptance. Some of them will be twiddling, some of them will be head banging. But like I said, you can't just take isolated components of what I've mentioned. There have to be an aggregate of these things. So even though some people would raise, oh, there is just this one thing, you need to come back and come with to your doctor and double check things before you panic too much. And yeah, so those are common things across. But of course, having said that, there are a lot more ways of describing um, these symptoms, and it takes a lot of taking a closer look at the patient, individualizing the patient, to really come up with describing these symptoms and these patterns. Patterns of behaviors, patterns of interest, maybe the tone of voice, body language, and all of that stuff that we normally see. Having said that, some also have issues with some sensory stimuli, either pronounced or just too little reaction to stimuli like sound or light. Some of them will cringe just because a spoon dropped in the house, or some of them would have meltdowns just because an ambulance passed by the front of their house. So there are some um, uncharacteristic response to certain stimuli that might be also revealing or suggestive, and might warrant a kid to get checked up.
Wow, wow, that is so good. So I'm wondering, 'cause I did a video earlier on today about, the higher functioning autism, previously known as Asperger's. How often do you see that in your practice? Because you remember you said, oh, most of these symptoms are obvious before the age of 2. But we find in psychiatry that those who are higher functioning tend to be picked up much later. So I'm wondering if that is something that you notice in your practice and how often they really turn up at your door.
Yes, you're very right about that. But one thing though is that you might notice that they have a little more advanced speech, really. You know, I'm talking about the high functioning ones. The
Yes.
parents will just make note of it. You know, it's not that common, but it is something that we can see even as earlier than age 2. And also, you will find that they just have some real savant skills. This kind of high functioning savant skills happen in like 10% of autistic patients. But it takes, watching a child closely to really recognize those really high functioning skills. These kids are like super talented kids, and
Mhm.
like I said, it's only like 10%. But can we pick it up before age 2? Yes, and astute parents can. Yeah, you would just know that there is something special about the child. Most of them, that they might have speech, but their speech, the quality might not be an interactive type of speech. They might have all kinds of vocabulary, but the use will be a problem. you know and and of course the interaction might be a little different, the humor might be strange or a little weird.
Mhm.
So there are a couple of things that will be a little off with those category of people.
Yeah, I remember in those days in Ireland, they would say you'd see these kids who are really brilliant and they speak with a British accent. The Irish would be like, this child has been in Ireland all their lives. Why are they speaking like they're
Aha,
British? Or
exactly.
they may have this interest in, maybe trains or computers, very unusual, circumscribed, narrow interests. I mean,
Yes.
it's been thought that Albert Einstein was on the autism spectrum, high functioning. So, who knows?
That's right.
Yeah.
And some
Mm.
people even said Isaac Newton was on the spectrum as well.
Yeah.
Charles Darwin was
Hmm.
another one. So a couple of people like that stood out in their days.
Yeah.
Yeah, there is definite suspicion of autism spectrum of some sort.
Yes, but then what you then notice is that difficulty with social interaction, social relationships,
Yes,
and so they may choose careers or interests that are very solitary because they have difficulty interacting with their peers.
100%.
So you've mentioned a little bit in your discussion, but I wonder if you can just maybe go into further detail as to how a diagnosis is made. So
Yeah.
you mentioned the parents will give information, the pediatrician will obviously do their checks. You mentioned those questionnaires. Is there any other important ingredient for a child to be given a full formal diagnosis of autism spectrum disorder?
Yes, there is. And again, it's a multidisciplinary type of setting and kind of way for the diagnosis to be achieved, because it would involve the speech therapist, it will involve the occupational therapist, it will involve the psychologist, the pediatrician. So it's a large group, and each one of them would do the assessment, called the ADOS, and there is the ADOS 1, 2, and 3, and the outcome of the assessment would rate the IQ, the intelligence quotient of this kind of patient. Like we said autism is a spectrum. It could be level 1, level 2, or level 3. So by the time the assessment is completed, the needs and support level is determined. So take for example, level 1 speaks for itself. They should only need just some support, compared to someone in level 3 of autism, where they would need very substantial support. um, and of course level 2 is just in the middle. So yes, it's beyond just our milestone checks, it's beyond the autism questionnaires, it's beyond the parental observation or daycare or caregivers observation. It goes into something as full blown as an ADOS, which can take, based on the kid's age and the kid's temperament, it can take hours, or it can be broken into chunks of hours per day, just to achieve the best out of that kind of an assessment. And having said that, we all know that autism is not like written on the face. They typically don't have any dysmorphism, but there are also some other group that you might want to throw in for an assessment for autism. So like the Downs, we used to call them Down syndrome, now trisomy 21 group. They could also be at risk of autism, and you know even just as part of their routine, it makes sense to also include them in that kind of an assessment. Definitely, there is room for blood work. It helps research. So there is a blood work called a microarray, which will sequence, you know, at least try to find out if there is any genetic undertone, because there are some conditions that are also associated with autism.
Mhm.
So, and with the microarray, you might be lucky to pick some of them up. We're not going to go into any of those other conditions today for the sake of time and knowledge of our general population. So, so there is that room for blood work. Some people would say that there is some room for functional MRI. What do I mean by functional MRI? It goes beyond the static MRI, which is
Mhm.
just like a picture of the brain, because generally the picture of the brain is not different, between autistic kids and those typical kids, except if there are some other background conditions that also manifest with autism symptoms. So, but the functional MRI, which that's a highfalutin thing, we try not to request for it, but that would only, you give an autistic kid an activity and you give a typical kid an activity and you look at how their brain is performing during that activity. That's what the functional MRI means.
Okay.
And that might also somewhat, lead up somewhat give you some idea in combination with all of those things that we previously mentioned.
Okay. I'm just wondering. So, I mean, we know that people that are going to watch this video later on are from a variety of communities. Some are back home where there are not too many resources. Some are in they have to pay out of pocket for investigations, for example, or resources. But in an ideal world, what kind of resources should be available to a child who has received an autism diagnosis?
Yes. So the in an ideal world, you really cannot do without your um, we call them ABA therapists. That's the applied behavioral analysis. Because once you're able to diagnose early and you start those group of kids in their age and severity level based ABA, you will see them just begin to blossom under your nose.
Mhm.
So the earlier, the better. You really want to diagnose and start in therapy before age 5 for you to get a good result. So like we were talking about speech therapists, so that would be one ideal personnel that you really need on ground, regardless of the part of the world. You need that ABA therapist. You need your occupational therapist, just because some of them really do have some high sensory needs, you know. And outside of that, you need a supportive set of parents, and I think we'll be good to go.
Great. So you mentioned the ABA therapies. You mentioned which is behavioral therapy. You mentioned the occupational therapy for the sensory needs, for the coordination difficulties. You've mentioned speech and language therapy,
Mhm.
and obviously the pediatrician. Sometimes they may have comorbid behavioral issues that are so difficult to manage. That's when mental health kind of gets involved. And again, school, I think school as they get older, having a support system at school is also very important. So
Yes.
for you as a pediatrician, after a child has already received a diagnosis, what does your role continue to be?
No, well, thank you. So, you mentioned the school, and somewhat we kind of liaise with the school as well as the other therapists do as well, because as the kids grow, the needs do change, and there might be need for like 3 yearly reassessments to see and assess what other needs would be important, or which, the level of therapy, if it could be revised to a reduced level if not needed, right? And of course, and if it's the opposite way, then it mean if it happens that the child has an increased need, then all of those supports in the school, like the educational assistant, would also be educated. And then role as a pediatrician is to advocate for the child. Sometimes, the school's board would need to allocate educational assistance to these children, but for lack of thin resources, sometimes a pediatrician might be there to advocate and write, to support the child and define the needs and kind of, help the child get what they need, even in the society, in the community. Sometimes they do need a little help in the community as well. We're talking about social interaction. Sometimes they need a little coaching to get them out of the awkwardness or the rigidity that might impact their social interaction with their peers, and they might need like a support personnel in that realm, just to
Mm.
fine tune their social interaction. And medically speaking, in terms of medications, sometimes they do need help with medications because of possible anxiety, and the anxiety stems from transitioning from their usual, just being isolated in their own mind, to needing to now mix with the world,
Mhm.
needing to embrace the rest of the world. That might cause them a little bit of anxiety, and they might need some help. So the pediatrician is there to to help and provide support and advocate for support, prescribe if needed, because definitely there could be some comorbidities as time goes on, even though the core symptoms of autism might get better, but we do see comorbidities later on in life.
Wow, thank you so, so much. Just before we begin to wrap up, I mean, what I'm hearing you say is early intervention is important, early identification of their needs, having access to a wraparound service that really, provides all that the child needs. And with that kind of support, these children can do well. So I
Absolutely.
think it's important for any parents listening not to feel that this is a hopeless situation. With early intervention, with a lot of advocacy, you know, the children can do well. So I'm just going to. I can't see any questions. Nobody seems to be typing any questions. But if you're watching a replay, feel free to type your questions. We will try. I will try and address them at some point. So before we wrap up today, I'm just wondering, do you have any last words for any parents who may be struggling, who may notice something unusual about their child? What kind of advice would you have for them?
So I would like to say that you have a unique child with, unique talents, and need to identify the strengths of that kind of a child, so that those strengths could be worked upon, and the few deficiencies definitely worked upon as well. But by no means are they, you know, children that need to be written off. Not at all. They are unique in their own way. They can do so much than you can imagine. Only get things done at the right time and see them blossom. Remove every feeling of guilt, even though we have mentioned possible environmental factors. You know, there's no point sending your mind on a guilt trip at all. Um, it is common, so they're not the only one with this condition, and they can, they are. It's like it can often be lifelong, but well managed. You see best results in these kids. And I must add that vaccinations are not a cause for autism, so you want to ensure that the kid is overall well looked after, and yeah, ask questions and get that support. Sometimes some um, focus groups or parental groups might also help, and you're not alone. We'll walk the journey with you.
Great. That is such great advice. Thank you very, very much. I mean, just to add to that, parents of kids who are on the spectrum, it's important to get support for yourself, for your mental health. Do what you need to educate yourself, to advocate for your child, to, get your own tribe. So, those are important things for you because the only way you can optimize your child's mental health is by looking after your own mental health. So in the next couple of weeks, I am going to be interviewing a lady who who is an education expert, a special needs education expert, and her area of expertise is dealing with kids who are on the spectrum, helping schools manage them. So it promises to be very enlightening. Once again, I'd like to say a big thank you to Dr. Aladetoyinbo. Thank you for taking time out to be with us today. We really, really appreciate this. And hopefully we can have you back again soon. Thank you.
Thank you for having me.